To it.
Time with family.
Good afternoon, Facebook friends and family. Well, good evening. What time is it? It is 7 p.m., and that means it is time for Couch Conversations with the Doctors. So come on in, come on in. Remember to start your watch party and share, share, share. As always, remember to share because what time is it? It's time for Couch Conversations with the Doctors, where health is true wealth. I want to say hey to all of our listening audience out there, to all of our Instagram, Facebook, Twitter, Periscope, all of our families, all of our social medias out there, our families that are out there. It is that time. It is Couch Conversations with the Doctors. We're going to go around our table as we always do, and we're going to do our introductions to everybody that is here with us on today. Our great introductions that we do with everyone. I'm going to start with my co-host, that is the man who says he's a chef extraordinaire, who does not barbecue meat because he's keeping it as a secret from Dr. Terry Mason. But he is also an outstanding infectious disease doctor over at Near North Family Center. That's Dr. Pete. Dr. Pete, if you can introduce yourself to everybody that's here.
Hey guys, happy to be here and share this panel with my esteemed colleagues. Hope we learn something tonight.
Wonderful, wonderful, wonderful. To that urologist of the stars, that's our very own Dr. Terry Mason. Dr. Mason.
Good evening, and thank you very much, Nikki and Congressman Davis, for providing this platform. And it is my honor to share this, as with Dr. Thomas just said, with my esteemed colleagues. And I'm grateful for just being a part of it and being able to share.
All right, all right. I want to say hi quickly to Marsha Oliver, who has joined us, to Linda Johnson, to Yolanda Williams, who's saying hello to everyone. So I want to say thank you so very much for being here with us on today. To the man who says I threatened him to be here, but you can do that because he's family. That's our very own Dr. James Miller. Dr. Miller.
Hey, good evening, y'all. We're happy to be here tonight, and hopefully that we'll provide some conversation and some information that will be helpful to everyone. So thanks for tuning in.
Okay. Well, to Deborah Williams, who is just as well, to Carrie Steele, who is here, that's the president of the Metropolitan Water Reclamation, and Mariana Sporopoulos, who is one of those commissioners. They want to say hey to her just as well, who has chimed in. Also to my coworker, Dr. Douglas Graham. Dr. Graham, if you can introduce yourself to everyone.
Good evening. I'm a physician who worked in the western suburbs for about 30 years. In the last year, so I've been working with Representative Davis in his office as a congressional fellow. Happy to be here, and I'll try and answer your questions if I can.
Wonderful, wonderful. To Audrey J. Cox, who is here, and also to our Cook County clerk, that's our very own Karen Yarbrough, who has checked in just as well. I want to say hey and have her introduce herself. And she is the woman who reminds us each and every time to make sure that mindfulness is a part of our life. And that's our very own Dr. Jasmine. Jasmine, if you can introduce yourself.
Good evening. I am so happy to be here. I am a licensed clinical psychologist practicing at Near North Health Service Corporation with my colleague, Dr. Pete. Yes, mindfulness is my thing, and I am grateful to be here providing any information that I can regarding mental health. So thank you.
Wonderful, wonderful. To that family doctor who is an excellent African dancer in her free time. That's our very own Dr. Maya Green. Dr. Green.
Hello, hi, thanks for having me. Yes, I love African dance, any kind of dance, anything to get your body moving, your heart going. I'm here for it. So thank you all to the wonderful panel. Thanks for having me. And Nikki, thanks for having me on. Congressman Davis, thank you for having me.
All right.
Wonderful. To our family medicine doctor who truly does think he's a chef. He wants to be the next man on the Iron Chef, and he wants to be very own weight loss guru, Dr. Tony Hampton.
Happy to be here. Always inspired to, chime in and help people. I really believe that wellness is the key to happiness. So my job is to help guide people and hold their hand. So looking forward to our conversation.
Wonderful. Thank you so much. And to our special guest who's here with us tonight, and one great thing that we share in common That's my twin sister there. I want to say hey to Dr. Brittany James. Dr. James, how are you?
I'm doing good. So happy to be here tonight. I am Dr. Brittany James. I am a practicing family physician in South Shore at Miles Square Health Center. I'm also the co-founder of the Institute for Anti-Racism in Medicine. So excited to be with this wonderful panel and happy to get into it.
Well, that is simply wonderful. But the vanguard of healthcare, the one who leads us and reminds us each and every day that health is wealth, our very own representative of the U.S. 7th Congressional District, that is Congressman Danny K. Davis.
You know, I had to kind of smile and laugh a little bit because I used to work in marketing, kind of, at Miles Square. I was special assistant to the president at the time, and it was actually my job to scout out South Shore and see whether or not we could bring some services to that community. Now that's been 40 years ago. I mean, that's been a
That's so
long
cool.
time. But that was the beginning of Miles Square trying to get into the South Shore community. And of course,
Wow.
Dan Cantrell at the time lived in South Shore and kind of knew that might be a place. But let me just say, I don't have much to say other than thanks to everybody for being here. But I will ask one question. Everything that I read, every place that I read it, every discussion that I'm engaged in relative to the distribution of the COVID vaccine, I am told that African Americans and Latinos, African Americans, Black and brown communities, are not getting the vaccine at the same level as other population groups. And so my question is not why, but what can we do about it? And so I always say that we always know the problems, but do we always get the solutions? So rather than cursing the dark, I just want to see if we can maybe light a candle or two. And if you can help me understand what we can do about the disparities in distribution of the vaccine. And that's my question. And I hope that you'll be able to give me some information so that when I go to DC tomorrow morning and be engaged in all these discussions the whole week about COVID, what I can say, I heard a little bird or a group of African American physicians told me on Monday night. So thanks so much.
So, Brittany, I know you are itching to answer that question. I can see it all over your face. Go right ahead.
Yeah, sure. I mean, my high level answer is we got to go through the community. I think one big thing we're looking at right now is we're looking at a distribution center system that really favors, especially our academic medical centers. But we know the heartbeat is in the community. So we have to partner with community leaders. We have to be on the ground. The ground game has got to be strong. We got to pick up this ground game. We got to be in churches. We got to be in nonprofits. We got to think outside the box about how we're going to get this vaccine to our communities. Because right now, the communities who are not as in dire need are certainly in line and certainly having better access than what we're having. And we've got to re-strategize, come together, put our heads together for our community and figure out how we're going to get this on the ground.
Maya, I can see it in your eyes.
Yes, thank you for asking. So what I love about African American culture and just Black people are we are a people who, no matter how far away we get from the motherland, we still move in tribes. And what that means is, if you access the tribe, you can access the people. So some of the work we've already started doing, I've started working with Dr. Miller already. It's good to see you on here. It's getting into the places where people worship, however they worship, and collaborating with the worship leaders and saying, hey, are you okay with us administering the vaccine or having talks about that at your place, not come to us. We're going to come to you where you are and administer it there. So that takes care of the soul, because we are mind, body, soul. You know, body, Dr. Brittany has already mentioned it. You got to get in those community-based organizations that focus on health and wellness in our communities and historically underserved and overlooked communities. And you got to put the vaccines in those places. We rolled out, for instance, for the body, we rolled out something, testing, when testing wasn't equitable. Because let's be honest, this idea of inequity, anytime you hear limited resource, that means that we're going to have issues with distributing the vaccine in the long run. So let's get ahead of it. So this shock after we find out, that's all fake. We need to move to strategy and move from shock to action. So that's how we're doing for the body. For the mind, you have to get into the culture. So we're getting ready to start this campaign called Slaying COVID. So I'm getting my second dose. I'm getting my second dose this Friday. I am going to be decked out, lashes, makeup, outfit, and I'm going to encourage other people to join me in slaying COVID. Don't just get the vaccine, slay while you do it, and share it with your community. We're also getting into talking into places where hair salons, people where lounges, people where people go, and collaborating and giving the vaccine there. It's one thing to be in the community. It's another thing to be of the community. So I'm excited. I'm excited. So we have to have people of all cultures, even within the Black community. From the academic, we need you. But if you're grassroots, we need you too.
Well, Pete, I know you are itching, but right before you start, I'm going to share this question with you from our very own Elise Buford, who asked the question, is there a plan to educate those community members who are fearful of receiving the vaccine?
Yeah, well, first of all, Nikki, I think this forum is an opportunity to educate and to inform. I think more of these sponsored kind of forums need to happen, and really with familiar faces like the faces that are on this panel. I do think I love what Dr. Meyer and what Dr. Brittany said as well. I do think we need to use fraternities and sororities as well. We got to use these culturally appropriate organizations. Maybe that means the Masons and other organizations that the community is familiar with. And also, I think our 330 and federally qualified health centers have to be empowered. And I think what this will do, if nothing else, is to say these organizations will need to become a regular part of the extension of the healthcare system. So it shouldn't be that we're just now trying to get these folks on board to help put out this message. I mean, we should have already had these organizations as part of our sort of satellites. And I know, like, for most of us that are in the organizations, I mean, like, I'm inadvertently the chair of the health committee for the Alphas. But I mean, we all need to use these organizations to help get this message across that vaccination is not an option for us. We're being disproportionately impacted by this. So we need to become very vested in becoming vaccinated.
Yeah. Mm-hmm. And I'll add to answer your question, Nikki. I just had the conversation with Rashard Johnson, who is the president of Advocate Trinity and Advocate South Sub Hospital. He called me, and and what's great about Rashard is that he's a 38-year-old African American president of two of our hospitals. So it's something to behold. He was able, in our conversation, to share personal stories, and we talked about systemic racism. And I really wanted to talk about that in the beginning because I didn't want to disrespect anybody who decides I don't want to do this because of fear. So my goal was to acknowledge that history, and particularly shout out to my Black women, because going backwards in 1800, many of the studies, if you look at the research journals, right, they were using my beautiful Black sisters as lab rats. Essentially, half the studies done in the 1800s were done on Black women, enslaved Black women, and probably even after that. And it's really disheartening. So we started the conversation there. And I think I shared this on our, on the Couch Conversations Facebook. So you should be able to find that conversation on the podcast. And then we talked about some of the myths. And there's a lot of myths about the vaccine that we wanted to. So I actually flipped the script and had him ask me questions so that we can get those answers. So I think to answer your question, Nikki, we got to do this over and over and over again. The good news is that a lot of people who are calling my clinic, their biggest issue is what you talked about to start, access. I want the vaccine. So more people than I thought are interested in the vaccine. So rather we're doing what my esteemed colleagues suggest in terms of getting in the community, even a mobile unit. We need a mobile unit. And if we have people listening who are, retired, I know some of our teammates on here are retired, but if we got retired nurses and other healthcare professionals who want to volunteer, because we may need them to be at the church when people are getting the vaccine so we can do it safely. So I know we're doing something at Imani Village, which is on 95th Street, 901 East 95th or so. But the goal is to, I agree with my colleagues, go to the community. We're not going to penalize you for having these beliefs. We're going to keep talking to you. We understand the fears. But for those who are ready and have made a decision to do this, we really strongly think this is the only path out of the pandemic. I really can't see another path other than vaccinations.
Awesome, simply awesome. Right before we go on, I want to say hey to Sister Bonnie, who's here, to Smitty Smith, who says, hey, Congressman, how are you? To Donna Miller, that's Commissioner Donna Miller, who has her eye on you, Brittany. She says, I see you. To Karen, hey, Karen. Karen says, good evening to everyone. Audrey Jaycock says, word of mouth by ordinary people also helps spread the word of convincing people. What information do we need to know to do that? So Dr. Maya Green, I know you are itching to say something. I know you are. And Dr. Tony Hampton, you pushed a button in her when you said mobile unit, because she's working on one right now and has it moving. But when everybody gets those injections, I want to share with Audrey Jaycock, post it on social media. Just tell people to do exactly what you did and post those pics on social media showing that you got your injection too. And that you still have one head when it's all over with. Go right ahead, Maya.
So just quickly, I always do this example. If we take our hand and we label it high blood pressure, diabetes, COVID, Hep C, HIV. If we cut off Hep C, because there's a cure, so get tested and get the cure if you want. The tree grows another branch, because the problem was never the branches. The problem is the root, and that's the inadequacies and social determinants of health and inequity. So yes, Dr. Tony, what we've already done, we have a mobile unit right now. It is getting ready to be deployed in Little Village because of what we saw, and then it kind of moved all over the city, and we converted it. We started it when testing was inadequately distributed, and then we're going to continue it with vaccinations. The other thing is, something I'm doing is going around and having these virtual visits in different neighborhoods. We recently did one in the Bryn Mawr area last Friday, and you should have seen the look on people's face. Dr. Tony, you hit it on the head. When I said, hey, let's talk about this, because part of the problem, you always hear African Americans, their mistrust. When the truth is, historically, the medical industry, a lot of room to grow, were not trustworthy to African Americans. And so just changing that nuance. And so many of those people said, thank you so much for saying that, because that takes a lot of times we got to be authentic with a narrative. So just beginning the conversation there. And also, one of the things I always say is our community is brilliant. It's vibrant. We are very well educated in our community. We were educated by history. Okay. And so in this moment, like you said, the best time to talk about the vaccine was when we knew it was going to happen. The second best time is right now. And so but that conversation needs to be listening sessions. That's the opportunity for me as the provider to sit at the feet of the tribe, of the neighborhood, and listen to how I can form myself around their needs. It's not a vaccine education for them. And when they want to know the questions, when they ask the questions like you're doing, Nikki, then we answer them. And then you see people want the vaccine, and more people as we go at their table, have it at their table, because it's the peer conversations, that 23 hours and 45 minutes that they're not spending with me, because I only spend 15 minutes with them, right? It's what they're learning in their tribes. It's the community conversations that are going to get us where we're going. So thank you so much. Yeah.
Wonderful. Randy Sadler says, good evening, everyone, on behalf of the Chicago Association of Black Social Workers. And he also posted his pick at University of Chicago on Friday, getting his vaccine. Dr. T, take.
Okay, we have a question. It says, definitely accurate that these health centers should be already a part of the solution, a part of the vaccination network. Let's redouble our efforts with medical centers, churches, barbershops, vaccine tents, and as soon as the weather break, be a divine 9. So yeah, we definitely are on the same page. And those are like community staples that are trusted. They're tied and trusted. Our barbershops and beauty salons are where a lot of that's where the tribe, if you will, goes to get all of our information, and where we can be ourselves and be our unique selves and not have to be judged. So I definitely think those are a part of it. And I think, to Maya's and Dr. Tony's point, we gotta be authentic and let people know that, yeah, as an industry, as a healthcare industry, we haven't been the most trustworthy partners. But that's why we're here, to not necessarily endorse the BS that's happened in the past, but to ensure that not on our watch, it won't happen again.
Well, let me ask, are we getting the vaccine? I'm saying, yeah, all of the heavyweights are suggesting that the federally qualified health centers are an integral part of the system. But I've been running into people who claim they can't get an appointment to get the vaccine. They don't know when their time is coming. When is their group going to be able to get vaccinated? And those are questions that I'm hearing from people having arguments that some hospitals have it, some hospitals don't, some facilities have it, some don't. Some people are giving it to you if you're 85, but if you're 50, you can't get it. So what's the deal? What's going on? How can people make sure that it's available to them?
Well, I'll chime in just briefly. It's complex. I think that most health systems, most of the clinicians on this panel would be so happy to give everybody what they need right away. But what I'm finding is, I think when we first started with Advocate Aurora, on that first day, we reached out to 20,000 people. Now, I don't know how many patients we have in our health system, but it's probably a big number, 1 million or whatever, So if you figure out the numbers and figure out, it's going to be difficult. So, and then you make it. And when we first started, it was like an app and all of these complex things. Now they're actually doing phone calls and other things. And then some people call and say, I missed my phone call. What do I do now? So I think it's very complex. But I think the biggest barrier, and that's where our leaders can help us, is we need access to more vaccines. So I think anybody on the call or on this panel or listening in, the first thing is you survived 2020. and you're still here, right? So, so the first thing you have to say, well, whatever I did to survive to this point, I'm okay. So you keep doing your social isolation and your masking and things like that. And then you understand how your particular health system is working. In our health system, we basically do outreach to them, which is very frustrating versus them reaching out to us. Why do we do that? Probably because we only have so much supply. So if we just let people kind of come at us, it would be incredibly challenging. So I would exercise a little patience. As you see the supply start to build up in our system, if you watch the news, I don't even watch the news, but the few times I did, all I kept hearing was, we don't have supplies. We don't have supplies. Governors are upset. Mayors are upset. So it's not because systems are not trying to give you these vaccines. There's just not enough vaccine to give. So in the interim, and I'm praying we get Johnson & Johnson and AstraZeneca approved as soon as possible, we need more supplies. And in the meantime, be patient and try to kind of understand what your system is asking you to do those things so that you can at least align with them while looking at other options. Some of my patients have ended up going to other places. Some of the pharmacies are doing it. Obviously, the Department of Public Health. So what are sometimes the village is doing it. So I would look at all the options available to you. But the key is, don't get frustrated because you're still here. And if you don't get it if you get it in a month, you'll probably be okay. The key is to continue doing the things that kept you safe.
Yeah, can I just add a couple of things to this? I think this is also a reflection of the what we see in terms of the healthcare in our community in general. What I mean by that is that some people are being notified by their healthcare system, like Dr. Tony said. Those people who were patients of advocate, they have a system of notifying. A lot of Black folks didn't have a primary care physician, and so now they have a circumstance.
Yeah.
And so basically they are not inside of they don't have a My Chart with Advocate. They don't have a My Chart someplace else. So reaching out to them individually is not happening as much as it's happening in some of the other community. So this is a reflection of that, and this is a time for us to figure out some real solution, not just for the COVID, but for the healthcare of the community as we go forward. So I think we have to do this, but not see it as a one-time kind of procedure here, but to see it as something that has to be continued. Just as all the other things that have been mentioned on this panel tonight, in terms of things that we're talking about doing, where we're talking about going to churches, we're talking about going to other organizations. I think we got to begin to know that we have to utilize these kinds of methods of helping to educate our people about their health and approaching them in a setting that they can understand and accept. What I mean by that is that if I'm nervous and about something, it is more difficult for me to learn. And so when we have folks coming to a doctor's office or a hospital, and it's not something that they do regularly, they're a little bit tense. And so so trying to teach them and trying to really reach them in terms of how this process is going to run becomes a little bit more difficult for them to grasp like that, as opposed to someone that is utilizing the system on a regular basis. So we got to begin to figure these things out and figure out other methods. If the usual method has not worked, then we have to figure out what will work and what will make certain that our people get the care that they need in this situation as well as in other situations. Because when the pandemic is over, there's still going to be a lot of health disparity and health problems that are going to be existing in our community.
Dr. to the point, I'm sorry, to the point you're making, two things. I've done a number of webinars with all different types of populations who are in their 40s or so, and they're like, I'm not taking that vaccine. I don't trust it. I'm not doing this. I'm not doing that. To the situations where right now people, I don't know whether it wasn't properly communicated or adequately communicated, but at my age, I can go get it. But if I bring somebody that's not in that age group with me, they can't get it. It's very difficult. And so we have some supply chain issues that do need to be worked out. There's just been a new partnership that I was on the phone with Kim Williams and a bunch of aldermen working with Walmart. They're trying to do some things to make vaccine more available to people. So we just have to, this is just a bump in the road. We're going to work through it. It's going to take some time. But the other thing that was a little dismaying to me, and that was the people who I thought were really, these are young people who are well-educated people who are sprouting so much stuff from these different sites and these things on the different websites, and it's not helping our cause. It's not helping our cause to do that. And so one of the things that we decided to do, and actually when I say we, some other folks, is that we're looking at what people don't realize is that Black people were integrally involved in the whole process of creating vaccines. Yeah. Way before Jenner even talked about smallpox, Black people had figured out that if you took the virus from the pox itself, that you could inoculate people and they wouldn't get smallpox. So we don't even have the right history about vaccines. And the second thing is, most of these people have never lived through not lived through anything serious. So they don't really understand. And so the other issue that we tried to get people to understand is that if you had been here during the time of smallpox, or if you'd been the time of yellow fever, or if you had seen iron lungs for polio, you would have a different perspective on looking at the role of vaccines. But because you haven't had a child that couldn't breathe or can't walk. I mean, I grew up at a time when we still had active polio. So I have a different perspective than folks who these days haven't really seen very much in the way of what viral things can do. And even though they're saying these vaccines are put out very fast, the truth is they're not. They've been put out in the time that it takes with the modern technology that we have today in the appropriate time. It's just that it's fast to you because you've never seen what it really looks like. So without taking any more time, it's also providing that perspective. And at some point when we get enough supply to allow families to come, but because of the tracking and everything else that has to be done, there's some other things. And lastly, we propose creating an app that would streamline this process very, very much. And actually meeting with Google tomorrow to talk about what we could do to streamline the process so that you could, and we did this when we did our STI project at the Department of Public Health, where you could just text COVID to a number. It would bring out a form. You could fill it all out on your phone or whatever you wanted to do. We need to create barcodes or QR codes. So when you walk in, we hit you, you scan the bottle the stuff came from, and all of that other stuff happens in the background, and leverage our technology partners to look at the traffic flow through these centers to help us use artificial intelligence to create the best possible traffic flow through these so that we can maximize, because the last thing you want is a whole tribe of people showing up. That is the worst thing in the world. It just does not work. And so I'll stop right there. And those are the things that we're actually trying to get some funding right now to try to get these technologies built so that we could do this far more efficiently, allow more people to be kept informed, and then follow up more with people, particularly if they have a comorbid condition, so that we can know early from them that there's a problem. And so, Congressman, that's what we are, when I say our group is working on trying to get a few dollars to go to a company. We don't want to build it ourselves. We'll go straight to Google, somebody that can also overlay all the mapping, where the center is, show you pictures, what it looks like on Google Maps, all of that sort of stuff. All that technology is available right now.
Yeah.
I don't think he's listening. So what you're saying is that those 10 Republican senators who are trying to talk Joe Biden and his group into reducing the amount of money that we're talking about putting into the next stimulus package, you basically are saying, tell Joe, don't listen.
Well,
I mean, everything ultimately becomes a matter. I think of Frederick Douglass, who said that he knew one thing if he didn't know anything else, and that is, in this world, you may not get everything that you pay for, but you most certainly will pay for everything that you get. You don't pay one way.
One way or the
You
other.
pay another way. So you're saying, tell Joe, hell no.
No, I'm just saying, let us work with the people that can help us streamline this process and use artificial intelligence to tell us what's the best way to move people through these things.
Wonderful.
Well, I certainly agree that we have to use every approach. You know, I hear people who argue about this way or that way, or needing this or needing that. I think we need every approach. And I think even the systems that we've put in place in terms of age categories and some other things, that we need to go beyond that for some communities, because there are other individuals in just as bad a shape, you know, at 50 as somebody else might be at 70 or 75. I was with Tim Black yesterday. We were celebrating Tim's 102nd birthday. And of course, Tim was just as eloquent as he always is in terms of his ability to articulate issues and problems and concerns. And of course, his wife was with him. And he said the reason he could do it was because of her cooking. And I said, well, don't listen to some of these guys, because you'll be fasting. Somebody they talked about, I was at church and they were talking about fasting and praying. And I said, well, I'm all with the praying. I don't know about all that fasting. I have a little problem with that. but we have to do everything, I think, that we can do, and just keep doing it. Keep doing it and keep doing it until it catches.
Wonderful. So Kathleen Jackson says hello and good evening, everyone. Melanie says, hey, everyone. Bernita Clinton says, speak the truth. Hosea Wilson says, indeed, great point, Dr. Miller. Deborah Williams says, it's a good thing that President Biden is reopening the health insurance marketplace. Hopefully people can take advantage of this special opportunity to get health insurance. Yolanda Williams says, it's a Black issue and we don't trust the government. We have been scared a long time, some people fighting against their spouses concerning this. Melanie also says we needed to hear from our Black doctors in order to believe the real facts. This conversation must be continued and shared. Philip Burton, the president of NAFI, says hello to everyone out there. Christina Denise Wales says hello. Thank you for all the wonderful programs you bring to our communities of color. I am a family medicine physician working at one of the FQHCs. And we have an Instagram comment that I know Dr. Mason is going to love. She says that I trust Dr. Mason and I love our congressman and trust him, but how can we trust what's in the vaccine?
Wow, you know, you really shouldn't.
Great question.
Yeah, I mean, it's just, you know, the vaccine is very simple, right? And I want you to definitely chime in, right? So the vaccine, you have this messenger RNA, which is just a sticky note that'll tell your body to make this protein. And the sticky note disappears. It's surrounded by a lipid bilayer, and the lipid bilayer is just to protect it because it's that fragile. And even though I'm a low carb guy, it's got a little sugar and water. That's it. A little sugar, water, messenger RNA, and a lipid bilayer. And I'm okay with the lipid, Dr. Mason. Just joking. But my point is this. It's not, why do we have to freeze it and have it minus 20 Celsius for, I think that's the Moderna, and Pfizer maybe minus 70 or something like that. Why? Because we don't have preservatives in it. So we don't. So if you think about it, it's probably as clean and plain as any vaccine we've ever had. So don't. And that's what's great about this forum is that you ask a simple question, you get a simple answer. There's no aluminum and all that mercury, all that stuff you worry about is not in this vaccine. What you do have in the vaccine is extend your life. It's a way to prepare your body in advance so that if that virus comes into your home, which is your body, instead of acting like you've never seen it before, your body has been pre-programmed to destroy that virus. And you have about a 5% chance of that not happening where it won't work. So that's a much better statistical situation than just waiting for it to happen. And then you say, well, I'm healthy. I do what Dr. Hampton does. I do what Dr. Mason does. I'm healthy. I'm good. You're not good because you didn't prepare your body for the war. It's like going to war and don't even know who the enemy is. So, and then you have to figure it out. So I think for anybody that's afraid of the vaccine for that one reason, you shouldn't be afraid of what's in this vaccine because technology, as Dr. Mason has suggested, they know they've been working on this technology for over 10 years. So, but anyway, Dr. Graham, you want to add anything?
Well, I was going to say the same thing, Tony. Like, we've been working on vaccinations for a long, long time.
Yeah.
So this isn't our first vaccination, but we're way up there, 50, 60, 70 vaccination. The most important thing is 75,000 people have been vaccinated. All vaccines taken into account. Of all those people, none of them who had the vaccine died from the virus. None of them had to go into the ICU. So if you're thinking about this as, well, does it matter what seatbelt I wear when I get in an accident? Well, you want to wear one, that's for sure. So the answer is, you've already had 1 year's worth of hard data. 75,000 people, 1 year. All these people are doing well and are with their families. Another thing to consider is when you get this vaccination, you keep some of the other people in your neighborhood from getting the same thing. Everyone gets vaccinated, that virus has no chance to land. So, as I said, 1 year, 75,000 people. If you went on Yelp or Open Table or TripAdvisor, that'd be a pretty good recommendation, I think.
Doug, to your point, I would also many of you who have children who are teenagers, and I don't know the family docs on this panel, but most of your children have had at least 15 vaccinations. 15.
Mm-hmm.
Okay, and they do it every whatever frequency your pediatrician recommends it be done. So, and these are vaccines, that are made just before we get ready to distribute them. They're not stockpiled. We have a reasonable stockpile so that new moms and new dads can get the vaccines for their children. So the idea of a vaccine vaccines are not new. And every year this vaccine is new because we have a new virus. And if we get a new virus and another new virus, we'll have to probably make another vaccine. So I just don't want folks to get excited about this because right now you talk to your doctor about the number of shots that your child has received. And if they're going away to college, they're probably going to take a meningococcal vaccine. So there are a number of vaccines that we use all the time. It's just that this one is new to you, okay? And it's not new. I mean, it's new on the scene because we got a new virus. And I can guarantee you, if we get more new viruses over time, you're still going to see some more. So this is the only tool we have. There is no pill I can give you for a vaccine. The only
Let
thing
me ask you
for a virus is a vaccine. That's all we can do.
I'm getting a lot of phone calls from people who want to sell me disinfectants and who want to come to my office and demonstrate and show me how they work and that you can put them in your HVAC systems and, you know, they'll purify, kill the germs in the air. What about these things? Are they good to deal with? What's going on with that?
No randomized controlled trials to prove that. And that's what I tell my patients, you know, who want to try different things. They want to, you know, eat sea moss and a bunch of things. And I say, listen, I don't have an opposition for those things. I said, but those things haven't been tested. This has been tested. 70,000 people took this vaccine, 40,000 from Moderna, 40 other thousand from another study. Look, fine. You want to drink a gallon of water a day, take sea off. You want to go on a fast, do that, but also go get your vaccine.
And then I just off of what Dr. Mason and Dr. Pete were saying. Yes, we probably got 15.
Where are we getting that feedback from? Because I'm hearing feedback.
It's when it's when the people not talking have their mic not muted. So to dovetail off of, thank you, Dr. Mason. To dovetail off of what Dr. Mason and Dr. Pete were saying, Dr. Mason mentioned that a lot of the reasons why we don't see polio, rampant smallpox, rampant diphtheria, things like that is because we got the vaccine. And then for those of you that are like, well, I'm a naturalist and I didn't get the vaccine, you also benefited from your neighbors who got the vaccine. Because the whole idea behind vaccines is if enough of us get vaccinated, we can deal with this thing. So even if you don't know if you got vaccinated, things like that, because the people around you, Dr. Tony, did you say I'm getting vaccinated for the people around me? Because the people around you got vaccinated, your chances of getting polio, things like that, and especially I want to hinge on polio because that's the reason why we don't have polio today, because we vaccinated so many people. And also to add to what Congressman Davis was saying, sometimes when we build algorithms without all communities at the table, it rolls out in a certain way that can cause an implicit, unintentional bias. So look at what happened in polio. If you look at the history, I'm a public health history thing, you know. So if you look at what they did with polio, they did something like what we're doing now. And then they realized, hey, we got to open this up. We got to make the vaccine readily available. So literally in polio, they had like street campaigns. You walk down the street, it was somebody trying to give you the vaccine for polio. And so we have to engage all levels. We need the academic institutions to give it. We need the Walgreens to give it. We need the Walmart. We need everybody. Yeah. And we need those barber and beauty shops because those are to engage, because there are people that will never use the technology that need the vaccine. There are people in congregate housing in spaces where they can't get a signal. And so we need to use the vaccine. And then we need to team up as a public health group to be able to do that. Sorry about that. To be able to provide what we need to our community. And it won't happen without it. That's the thing. COVID, we know our boundaries. We know geographical boundaries, Illinois, Indiana, things like that. We know color. COVID doesn't know that. COVID doesn't know it. So one community will not heal without the other. This is a test of our unity. That's what this is, you know, and we have to do it. And no group will, the elite won't heal without the grassroots. It won't happen. So I'm excited. Yeah.
I was going to add with Dr. Maya, that was good. And also, I think all of us are privileged in some way, even though we may be from different communities, cultural identities. But I'll give an example. I mean, I received the vaccination way before my family and friends, but also because I'm a community of connected people in Chicago, I had people, at least 20, texting me saying, "Hey, they're about to throw this vaccination away. Do you need it?" And I was able to contact my loved ones and friends to get them in to receive it. So that's just another thing that we can do, just being connected as professionals. So because everyone don't have that opportunity. So.
Yeah. And I also definitely have to add, in addition to these great points, another food for thought that I'm talking about with my patients. If you're only looking at what could this vaccine do to me, and we've already had a year's worth of data saying this is safe, you also have to look at what's the risk of me not getting this vaccine. At this point, we have to look at the fact that we're at a point where January was our most lethal months of this pandemic. We are seeing 3,000 to 4,000 people a day dying of COVID. And in our own city of Chicago, 70% of the people dying are Black. So again, you have to weigh that. It's not a either get it or don't. Yes, you can social distance. Yes, you can decrease your odds of getting it. But at the simple fact of the matter is, our community is carrying the burden of this disease. This is a Black and brown people are getting wiped out. So really weigh that for yourself and your family. And the other thing I want to add is, as we're talking about access, and I just love the points brought up. Of course, we got to be strategic about reaching out with different partners to get this rolled out. But I really think we need to talk a lot about what we mean, but when we say access, because it's not just a matter of, can I get to the doctor's office? I have patients who don't have transportation, who don't have anybody to drive them there, who are lacking internet, who are lacking phone service to even get an appointment. And again, we already know the Black community is behind getting primary care, so we are not connected in the first place. So again, when we're talking about access, we gotta be broadly. We gotta look at the fact that economically, Black people, again, 40% of Black businesses are closed from this pandemic. There's an economic toll on that is wiping, that is also disproportionately affecting our community and affecting our ability to access care. So when we envision solutions, we have to not just, again, as we've all really are circling around, not just focus on just, can I get an appointment with a primary care doctor? How do we get you connected to insurance? How do we make sure you have a letter to your employer to even get off if you have side effects from the vaccine? How do we make sure that you have phone service? And if you don't, how are we going to get you in? These have to be a part of the conversation as we're thinking about how to reach our community.
Dr. Brittany, that's why we can't just say, hey, come to us. We have to have those units you talked about, Dr. Tony. We have to be in the beauty shop. We have to. We talked a lot. Look what we did with HIV awareness. We talked a lot about being in the barber and beauty shop and things like that. We talked a lot about understanding the impact of a worship leader. Impact of a leader that may not be focused on worship, but the leaders in the community. And so we don't have to reinvent the wheel on this. Let's access those spaces. This is the time where we're going to have to vaccinate in the barbershop, in the beauty shop, in the lunch. We're going to have to do it. So being able to do that in the church, some of you have seen me around. I don't necessarily need to proclaim to a style of belief to go in there. I proclaim to humanity and caring for that's my job, and caring for my community and being there for my community. So Dr. Brittany, that is why, because like you said, some people do not have access to be able to get that primary care appointment, do not have transportation. That's why that mobile unit has to go to them. That's why we have to be in those spaces. The corner stores, we have to do the vaccine. Polio showed us, if you are out there and you look at the history of how we wiped out polio, we did it by taking the layers off, taking the bias off, taking the barriers off, destroying those barriers for our community, putting equity in action. So we can, plan and everything like that. You're going to have somebody that's going to go in that street. You're going to have that street person to go in there and put the vaccine in the arm of the person.
So Shauna Black Ice Jackson says, good evening, everybody. We have another comment that says, real talk, the docs. Dr. Tony and Dr. Mason, those were such powerful points. Also, Dr. P. Yes, the elite won't heal without the grassroots involved. This is international as well. To avoid the long lines, I will go to the church or other places in our community. Kathleen Jackson asked a question, and she says, if you've had COVID within the last 2 months, do you get the vaccine?
I say yes, because just because you've had COVID, that might mean you have a short-term amount of immunity, but that immunity does not last forever. They think it wanes in about 2 to 3 months. The vaccine, we think, has an immunity that lasts up to 2 years. So there's two different kind of immunity. One is the neutralizing immunity. One is just a regular immunity. So you definitely should. Now, if you think you have active COVID, that's different. I wouldn't get vaccinated if you thought you have active COVID. But 2 months afterwards, you should.
I just wanted to go back to something that Congressman Davis raised a little while ago about aerosols, disinfectants. And most of those aerosols only work if they are virucidal, and a lot of them may not be. They may not kill viruses, and it may not kill this particular one. But if it happens to, it's only going to do it for a very short time, probably as long as the surface is wet from the spray. So it is not a panacea. You can't just spray it and think everything is fine, because it is not. Because as soon as that dries or it evaporates, because it's alcohol in it most of the time, whatever you sprayed is gone, and whatever protection you thought you had is gone.
And also remember, all these products are great, but I'm a holistic person, and my heart is holistic. They are in some ways toxic as well. So if you overuse these products thinking you're trying to be safe, besides getting a rash on your hands and everything else, you may actually be predisposing yourself to harm. So I want people to use products to be safe, but don't overuse those things. I mean, our ex-president was talking about Clorox and crazy talk like that, right? So we don't want to think that if we have access to all this stuff, all of a sudden it's magical. What we would argue is get the vaccine to have the best protection while also being the healthiest person possible. Something as simple. Are you getting enough sleep? Are you over consuming the news and your stress? Are you, fasting? Our representative said he can't stand the idea of fasting. And that was funny to me, because I just realized this, and my partner in crime, Nikki, would understand. Guess what? I haven't eaten today yet. And I'm like, I forgot. And you know why I forgot? Because you become adaptive to things once your body gets used to it. I'm going to still eat tonight, but we overeat. And when you're spending all this energy eating, you actually make your immune system weaker. Your immune system don't have time to protect. Drink your water. But your immune system doesn't have time to fight infection, because you're too busy digesting all day long. So when we take a break from eating, we have magical things that happen to our body. We have this process called autophagy, which helps us to get rid of, things that are, debris and bacteria and cells. And your immune system gets stronger when you stop eating. So there's a lot of myths out there about how to be healthy and how not to be healthy. But the bottom line is, if you do the right things and treat your body right, then you will have a better chance to fight this virus if you get exposed. But there's probably nothing I can tell you that's going to help you more than having a program in your body from a vaccine to target that vaccine. So don't get caught up in the lie that if I'm just healthy, all of a sudden I'm somehow, as my brother Pete was saying, all these herbs and stuff, that stuff is great, but it's not going to protect you to the degree a vaccine will. So never get those two things twisted.
And I actually want to share just as well. They talked about the chemicals and making sure that you use everything in moderation and all of that. But those 6 phone calls I got at the office today, and the text messages and some of the messages we're getting here today, it is a myth to think, a huge myth to think that if you are in a crowd of friends at your house and everybody uses mouthwash, you can then take your mask off. Don't believe that, and don't do it, or you all will be testing positive.
No.
Wear the mask and social distance. I don't know where that came from. Maybe that's a part of that Clorox thing that we're talking about. But do not think you can use soap. Everybody comes in the house, wash their hands, use soap, and then you sit at the table and everybody can unmask and sit and parlay. yeah, everybody's going to be positive. And some may not make it to the
Brother
next meeting.
Brother Pete made it clear, if there's no randomized controlled trials showing that it's okay to do that, then I wouldn't go there.
So stop believing that research purposes only. But this information here can be proven. You know, Felicia Cook says, I was late to the conversation, but I wanted to ask what efforts have been made to reach out to the churches to share vaccine information or possibly be distribution sites.
So I can answer that partially. And that actually at the level of the National Institutes of Health, there are programs to reach out in the communities and to reach the community leaders. I can't say anything about whether they're going to the churches or not, but they do understand the scope and the magnitude of the problem in communities of color. And they do have programs developed.
You
Perhaps
know,
now they'll have more momentum than they will in the previous administration. That would be another thought I would have.
I'm not saying that we should be this dramatic, but something just occurred to me that I would almost tie academic centers to community-based organizations. And if the University of blah, blah, blah get it, you don't get your batch until you assist Bethel Community Church with giving vaccines out. University of so-and-so, you don't get your batch until you assist these three community organizations. So you have to send nurses, send doctors to these sites in order to get your batch.
Yeah.
Well, many of the church denominations have made themselves available. They are open. They have actually contacted distribution centers. They are contacting elected officials. They're contacting Joe Biden's folks. They are contacting the community where we are. We have some of the most activist-oriented churches in America. Although sometimes we have to know that the other groups are very active too. The evangelicals who believe a lot of stuff I don't quite buy into, they're very active as well. So the churches are there, they are available, and are looking for ways to be helpful.
Yeah.
And even within our health system at Advocate Aurora, when I was medical director for the Advocate operating system, we actually had the thing is, those patients that go to the federally funded clinics, they still come into Advocate too. So they're going to come into our ERs anyway. So what we did is we developed a model where when a person came there and they had, it's like a trauma thing almost. Let's just say you're homeless. What do you do with a person? You take care of them and they're homeless. What do you do? Or if they are in a certain community where a federally funded clinic lives, how do we partner with that clinic so we're working on things like that right now, because at the end of the day, we're taking care of the same people anyway. So we might as well figure out how do we link each other so that we can mutually benefit. This may be a longer term strategy, but these are the types of models that will help keep our communities healthy, because the resources for Advocate Aurora may be greater than a clinic that depends on all their funds coming from Medicaid or state related funds. So we have to partner. And like Brother Pete was saying, maybe I need to spend some time over there sometime just to make sure they have access to enough clinicians. Because we can say, well, we need to make sure we got all these resources in that clinic, but if they don't have the manpower to make this thing happen, then it won't happen. So it is going to require a more, and that's, without getting political, that's one of the reasons why we should have healthcare for everybody, because then we can eliminate some of these barriers, because then we're not worrying about what's the insurance and all this nonsense. Can we just take care of people? And if we take care of people and eliminate that barrier, then it'll get much easier. So that's kind of how I envision health systems that are larger working with maybe smaller systems.
One of the things
I want to say to that, Tony, that I'm sorry. I just want to say to that it's not just walking in and getting a shot. There's a lot of record keeping that has to go. These things have to be recorded. They have to get back to the CDC. There are a number of different things that happen. So I don't, although people might want to do this, they need to really sit down, work with someone who has done this sort of work, understand what the requirements are in terms of the records you have to keep and the way you have to do it so it can be done properly. Because the other thing is, the worst thing you want to happen is you take the first of the Moderna shots, then you forget what you got, when you got it, and all that other sort of stuff. So there's more to it. I'm not trying to make it complex. I'm just trying to say that it's not just you just open up, and then you got to have people who are qualified and licensed to be able to give injections, and you got to have somebody there in the event that there is an adverse reaction, because those people have to wait for 15 minutes after they receive their shot. So there are things that happen that have to be put in place for your safety. And you want to make sure wherever you go to get the shot, that those things are there.
So one of the reasons why I'm in the FQHC in Chicago, one of the reasons why we specifically started doing the testing at site and at the meeting, and I know Dr. Miller, you can, if you want to, I see you're getting ready to say something. So at the meeting, what we'll do is we'll fill out how that worship leader feels about the vaccinations coming up and things like that. So we are an FQHC that's already in some of the churches. We have one of the churches, and Dr. Miller, I don't know if you want to talk about it, coming up next week, where we're going to be distributing the vaccine in the church. So there are people already doing the work, already collaborating, and we use the testing relationship on how to track them in the EMR, how to find this person if they're positive. We use that to build on. So now when it's time for the vaccine, contacting them on the 28th day because we're using Moderna, we already have that in place. And I want to thank Dr. Miller. I didn't know you were Dr. Miller. So when we went to a church, and I don't know if you want to tell more about it. We went to a church and we started off on that, like, hey, talking about testing. The first thing out of Dr. Miller's mouth was like, okay, that's great. When is the vaccine coming out, and when are you going to, give it to the community? Dr. Miller, I don't know if you want to talk more about it.
Yeah, so what we've done at the church that I go to, as well as this church is, I got three brothers, first of all, who are pastors, and they are also part of an organization of many pastors. A significant number of them are on the west side, the south side as well. And so we partnered with Howard Brown and in terms of doing testing, because we were encountering a lot of folks who were inquiring about how can I get tested, and that I can't. I've been trying to get tested, I'm getting rejected. So we reached out, and we found, as a matter of fact, Nikki actually hooked us up, and we have been able to set up the testing, and now we're setting up a process to start the vaccination at our site. We have a community center with a gym in it, which is a sizable 5,000 square feet area where we can do that, as well as our connection with the other ministers in the community will allow us to be able to go out and to educate and to connect with a larger number of people in the community, where we can pretty much talk to them about what's going on and what they need to do, and how we can make that a little bit easier for them. I think the whole thing, again, is to create a situation that the people are used to. Sometimes you got to go to where people go. As I used to say, why look for people at a place that they don't usually visit? Yeah, you won't find them, but you go to a place where they visit, that's where you'll find them. And so people, Black folks, go to church. A lot of them go to church, and that's a place where we can begin to talk to them, because they are in a situation that they feel comfortable, where they feel they're trusty individuals that are there. And so we've sort of connected with Howard Brown and Dr. Meyer, and I've been having discussions with their group in terms of how we can expand upon this and start vaccinating people in the community, because they're complaining that I don't know where to go. People are frustrated, and when people get frustrated, they make a lot of noise. And so we need to be able to do something to bring down the noise and bring down their level of frustration and show them that what we're talking about is available. It does no good to tell people that something is available and they can't find it. So.
Right. Yolanda Williams says, where can I get COVID information to spread the word? Our foundation would love to feed the communities and pass out the information. Yolanda, you can go to the CDC and download all of that information, or you can go to any of our FQHCs, Near North, Howard Brown, Miles Square, Esperanza Health Access, any of them. You can go to any of their websites and get that information. And if you remember, if you give me a call tomorrow at our office, so I know you have the number, and I can email you some of that information just as well and those connections. Jose Wilson says, Dr. Jasmine, Dr. Maya, Dr. Douglas, and Dr. Brittany, our communities need this information. And the strategies you share are practical and will work. Angela Underwood says, what effects would the vaccine have on a person who may have COVID-19 but don't know that they have the virus yet? Brittany or Maya or Dr. Hampton, which one of you guys want to kind of tackle the fact that there's a process in place when you go to get that vaccine? Oh, and hey, Uncle Terry from Miss Thomas. Dr. Mason, she's talking to you.
Who?
Tamika Thomas. Hey, Uncle Terry.
Oh, yeah, that's my niece.
So, Dr. Brittany, you or Tony or Maya, any of you guys want to tackle that whole procedure you have when you go to get the vaccine? Oh, Pete's back. Pete, too. You're muted, Brittany. Now you're muted again.
Can you hear me now?
I can hear you now.
All right, good. Yeah, so I got both of my vaccines. I've been vaccinated for actually a couple of weeks now. I got the Pfizer vaccine. It's a whole process. They give you a questionnaire and everything that you go through. But I think the big thing, so I guess the question was, if a person who may have COVID-19, but you don't know they have it, we don't, of course, we don't suspect that it causes any problem. We have no evidence that it causes any problems. And I'm sure of those 75,000 people, someone must have had COVID and they're doing just fine. Again, this is a safe vaccine from everything that we know. And I think another way to think about it is a lot of our recommendations come from thinking about what's best for the group, knowing that we have limited supply. So I do actually think the standing recommendation right now is within 90 days of being infected not to get another vaccine. That's not to say that it's physically unsafe. That's to say we have a limited supply. We think you have some immunity for 2 to 3 months, so there may be a better person in the community that's for. But again, when I went, we're monitored for 15 minutes to make sure there's no reactions. I personally had a very pretty good time, in terms of side effects. In general, I like to tell all my patients, I tell them exactly what happened to me. I got the vaccine about 12 hours in on the first one. I had like a light headache. That was about it. That went away after a couple hours, nothing to even slow me down. The second one was a little more. My big thing about 12 hours in, I felt tired. The headache was a little worse, but again, all said and done, within 24 hours, I was back at it again. And again, I feel so blessed to have had that, because comparing that to what the risk of not having it, I will take 24 hours of just about anything to know that my safe. My husband's also a physician. We have a young daughter. And again, I'm breastfeeding and I got the vaccine, safe in breastfeeding, safe in pregnancy. And so, we have to look at that, look at the whole picture, but you are monitored, it is safe. And it can really save your life, your life, the community's life.
Tony, Maya?
About the process of getting the vaccine, to dovetail off what Dr. Brittany was saying, you definitely still want to let, when you present or show up at the point where you're going to get the vaccine, you still want to let the team know that you either had COVID. The other thing we want to talk about is if you received any other vaccine in the last 14 days prior to that, there's a recommendation that you wait 14 days. You let them know if you've gotten any other vaccines. You still let them know if you're pregnant or with child, and you let them know if you had COVID within the last 90 days. And so from there, you just check in. One of the things I do tell people, please do not leave without scheduling your follow-up appointment for the current vaccines that are out. So the one thing you want to ask before you leave is, when is my follow-up appointment and where do I have to go? The other thing, so you get the vaccine. For a lot of people, that vaccination process has been just like the other vaccination processes. And then Dr. Brittany talked about some of the things that happen after you may experience. But I also want to really hone in on, there's something called V-Safe, which is what the CDC is using to collect information. So if I'm having that headache that Dr. Brittany was talking about, if I'm nauseous, if I feel a little fatigue, I log it in. And so that's the CDC's way of making sure that we're keeping track of people that have symptoms. They also have, on the other hand, a way that if your symptoms are severe, they're supposed to be able to reach out to you. So when I go to get my vaccine, I let them know if I got a vaccine already within the last 2 weeks, if I had COVID within the last 90 days, if I'm with child, or if I, have anything else, if I'm on medications that block my immune system, I also let them know that. Then at the point of, and if I have any other allergies, at the point I get my vaccine, I turn around and say, hey, where's my next appointment? Okay, where is it? I write it down. I also say, do you have that link to where I report my system, my symptoms? And you take a picture of it with your phone, or you take down the information, put the flyer, and so you keep track of that. To dovetail also off of what Dr. Brittany is saying, some people are having symptoms, and I recommend. So when people were like, "Oh man, I had all these symptoms," I said, "Do you remember when you got your child vaccinated for the first time?" And they told you that baby might have some symptoms afterwards. Okay, that's what this is like. Some people are having more symptoms with the second dose than the first dose, but it varies for everybody. And by far, we're not seeing a lot of very severe symptoms.
The only thing I'll add, Nikki, just quickly, is there's variation. These are recommendations from the CDC. I have seen some variation where one health system does it this way. They do have a little ability to be flexible. So I would talk to your particular health system and just ask them, for if you're in that situation, you're not sure, just find out what they may recommend, because they don't always follow the CDC to the tune. But and even in our health system, one of the things they've asked us to do, it's all about do the benefits outweigh the risk? So if I have a person in front of me who I really think they should get the vaccine, no matter what their scenario, they've given me the ability to still give that vaccine. But you have to, as a clinician, collaborating with the patient, you decide, do the benefits outweigh the risk? Because we don't have, as Dr. Pete said, we don't have all the studies to say, it needs to be 5 days, 7 days, 14 days. It's kind of a guess, and they're doing their best job to guess what's best.
Wonderful. I'm going to say, sorry, go ahead, Pete.
No, I was going to say that the last thing was, if you think that you have an allergy to vaccines, or you have a history of allergies, you should let the person know, because there may be special conditions in which they want to vaccinate you, i.e. in a place that if something goes wrong, they can easily take care of you a little bit easier. So just, if you have allergies, and particularly allergies to medications and things, let the person know, or the site that you're going to know ahead of time.
And you're just going to sit a little bit longer than those 15 minutes, but you'll be okay sitting there a little bit more than those 15 minutes. I'm going to say something that I know our listening audience does not want to hear, and that is, we've reached our time for this Monday. We're going to ask these last two questions really quickly, and then we're going to wrap up with our until next Monday. So Tamika Thomas says, what are the expected side effects? Is there a list of them? And then we have a gentleman who has kind of asked this question a couple times between Periscope and Instagram. And that is, I am afraid of Bell's palsy. There were people who got it after they got the vaccine. What are your thoughts?
So
I don't know
Bell's
who wants to
palsy.
take Tamika's question and who wants to take the Bell's palsy.
Yeah, I'll take the Bell's palsy. If you follow everything that's going into the medical literature, that has not been a serious problem, as far as I can tell. I haven't seen anyone who's had a long-term Bell's palsy lasting longer than you might expect. For me, if I had the choice between Bell's palsy and ending up in the hospital, I think my vote would be Bell's palsy. Because once you're in the hospital, it's a slippery slope.
Doug, I have a question for you about Bell's palsy.
Sure.
Can you die from Bell's palsy? Is Bell's palsy fatal?
No. Bell's palsy is a temporary paralysis of the nerve, and it goes right along your ear and it affects your face. Most of the time, it will resolve, and some of it can resolve with treatment. So it's a minor thing, as opposed to the seriousness of this infection, which can cause long-term damage to your critical organs like your heart, your lungs, your liver, and your kidneys. So, it's kind of a low risk, high reward to get the vaccination for me.
Has Bell's palsy ever put anybody on a ventilator?
No.
And can you get Bell's palsy from any vaccine that you may take?
You can get Bell's palsy without taking the vaccine at all.
Yeah.
Thank you. Thank you so much. So just wanted to ask that question.
And the reason I want to say that, Nikki, is because a lot of times people that may get it confused with the person having a stroke, because the mouth side, the left, the one side is going to, your face is going to droop. They may not be able to talk well, but they'll always be able to put their hand up. They'll always be able to still move their arm or hand. So, it's always, if you're concerned, always get it checked out. But Bell's palsy is very, very common. There's a virus that usually causes it. It does take a while for it to go away, though. And it usually goes away without any treatment. And
who wants to tackle, has Bell's palsy put anyone on a ventilator?
No.
Right. So it's never caused anyone to be intubated?
No. You can't do that.
All right. And
COVID has.
Right, but COVID has, right?
Yeah.
Thank you. I was trying to pull that out of you guys. I was trying to pull it out of you. It's also been fatal, right?
No.
In the numbers of hundreds of thousands of people.
No.
Yeah.
Yes.
Okay, Bell's
palsy is not a fatal condition.
Right.
It's like getting a second-degree burn on your finger or on your arm. The body generally recovers over a period of time. And it only affects that one particular region. It doesn't affect other parts of the body.
Okay.
And let's not also forget that a percentage of, even in that intubation isn't the only thing we worry about COVID. There's a percentage of people who go on to have what we call long haul COVID, meaning that even after you recover from the initial infection, you could go on to have long-term neurological complications, cardiac, dizziness, memory issues. We're just starting to really identify and understand this condition, chronic fatigue. So again, even if you do survive the initial insult, we are still a percentage of people who go on to have long-term consequences. So it's not even just about intubation. That's bad enough, but there's even more. Bell's palsy doesn't do that.
So the other thing is, it's really rare. It's 1 in 10,000 people vaccinated. I mean, that's low.
Thank you guys so much. Tamika's question, who wants to grab? What's the list of expected side effects from the vaccine? I believe she's asking.
Well, the usual side effects are local site tenderness, where they give you the injection. You get swelling and some redness. Sometimes you can get fever, headache, and some chills. Usually that's after the second vaccine. For me personally, I didn't do, the old school nurses tell you, you gotta take some Tylenol ahead of time. You gotta rub it in. So I was just I thought because I lift weights that I would be able to, that thing was pretty tender. But it was just regular tenderness. It wasn't no more than what, and then eight hours later, I couldn't feel it anymore.
So you lift weights to have tenderness. The Congressman Champion had no problem.
Just
messing with you. Virginia Knight says, thanks, great information. Kathleen Jackson says, part 2 next week, please. Audrey Jaycock says, every Monday, excellent panel and excellent information. Thank you so much for the information and your time. And Mimi says, hello, Felicia. Thanks everyone for answering her question and great information. And there are tons of people just chiming in saying thank you so much. But you know what, Dr. Mason, if there was something you wanted to share with everyone here tonight, what would it be until next Monday?
Until next Monday, I wish we would have as much concern about what's in a chicken nugget as we do about this vaccine.
That's why I keep my tissue between you and Pete. That's why I keep my tissue. But that's in my agreement.
Serious.
I know you are. Right. Dr. Maya Green, you're until next Monday, and you're going to bring the information on what's in the chicken nugget to Dr. Spearman.
I am. And then we have other things that people purchase from people that are not pharmaceutical sales representatives, that are not FDA cleared, that we never ask questions about. In fact, we might know that person to be a known criminal, but we will buy their stuff and put it in our body. Don't get me started.
All right, that's it. I need this for Maya too now.
So,
you're until next Monday, Maya.
Okay, I would say until next Monday. When it's your chance, mask up, and then when it's your chance, step up, get vaccinated, and be part of the solution.
There you go.
All right, Dr. Douglas Graham, until next Monday.
so what I would say is it hasn't started well. On the other hand, the administration did not pick up a fully prepared and trained team. And so they're really trying to pick up the pieces, reorganize it. And all these things that we're encountering now are going to get resolved. It's just that there's a lot that needed to be done that wasn't done, a lot that could have been done, wasn't done, should have been done, wasn't done. It's going to get done. And we'll see this to the end. So it's just going to take a little bit more patience.
All right, Dr. James Miller, you're until next Monday.
Until next Monday, exercise patience. And when you have the opportunity, get the vaccine.
Yep.
Okay. Yolanda Williams says, Dr. Mason, you just don't give us a break, do you? Tina says, I agree with that chicken nugget comment. Dr. Brittany James, until next Monday.
Until next Monday, as always, we are survivors as people. We are a community. We will get through this like we have got through everything else as long as we come together, and we will.
All right. Dr. Tony Hampton, until next Monday.
It's really about the numbers, guys, and we have to understand that if people were gonna not do well with the vaccine, it would be like a plane crash. It would be all over the news, and we're worried about this vaccine. But if you're not hearing about vaccine crashes all over the news, then you're worried about the wrong thing. Every day in my health system, I have to share the number of COVID deaths in Illinois. And think about the number of deaths you've heard from the vaccine. In Illinois, we average 40 deaths all the way up to 200 every single day. Think about all the long-term negative effects that Dr. Brittany just talked about. I have patients calling me, and it feels like it's 1 out of 3 or 4 people. I'm still sick, doctor. I'm still sick. I'm still short of breath. I'm still having chest pain. I'm still fatigued. Why would you take a chance on that when you can take a vaccine, which is not even making the news right now? So I ask everybody to really reconsider what you're fearing. And sometimes when you're fearing the wrong thing, sometimes doing nothing is going to cause more harm. So just take a moment and pause and ask yourself, if only 1 out of 100,000 people are having reactions, anaphylactic, and of those people that's having it, they're not even dying because we know how to treat these things. You have to really ask yourself, what are you fearing? So I really encourage you guys, even to listen to that conversation I had with Richard, which is in this Facebook link, and just learn more about the things that you shouldn't be fearing so that we can help you make the best decision for you and your family.
Wonderful. Dr. Pete Thomas, until next Monday.
Yeah, until next Monday, I would just say I'm hoping and praying that we will, as a community, support each other. I like the fact that what's been happening is that If there's a certain source for vaccinations that are available, people are sharing those. If it's outside of your particular healthcare system, go get your vaccine. It doesn't matter. The point is that we're sharing when various pharmacies have 10 or 12 doses left, and we can share this and help. Hopefully, the community will see that we're stronger together than we are apart. And then I hope that at some point we start to focus on our public health infrastructure, because if for nothing else, COVID taught us is that our public health infrastructure is not prepared to deal with a situation like this. And so long after this is over with, I hope that we can build on this to help mend up our healthcare infrastructure.
Congressman?
Well, until next Monday, I've forgotten exactly who raised it, but someone raised the point that we sometimes don't know the work that people have done. And given the fact that this is Black History Month, I want to mention again that Blacks were doing research into the whole business of immunities, the whole business of vaccinations. And some people don't know that African Americans were very instrumental in developing vaccines and the concept of what vaccines do. And then because it's Black History Month, the brother who gives us the opportunity to have these kind of interactions, I am told that it was a Black guy that developed and created the internet. That a brother did that. And that if we didn't do these things that we do, celebrating achievements, sometimes people wouldn't know this. Until I found out that a brother did it, I didn't know it. And I was not only delighted, but I was also a little bit amazed. So Black History Month is indeed a time. I want to give a shout out to the Illinois Department of Corrections, because they have distributed and are distributing 30,000 letters to inmates that I wrote, encouraging them to make use of the vaccines and telling them why they need to do it, and the fact that they can't do as much social distancing as some other people because they are locked up. And I've already gotten some communiques back from individuals who are incarcerated saying, hey, thank you for just reminding us that we need to take this vaccine. They also have distributed video, 5-minute video, so that all the inmates who want to view and hear can do so. So I want to just give that shout out to the Illinois Department of Correction for helping to make sure that those people who are contained also are given the attention and the care that they need. The other thing is that I do believe that the idea is catching on, that there are people who initially were adverse to the vaccine and were adverse to taking it, who are beginning to kind of soften their resistance a little bit. And so if we continue the effort, then I think we're going to be all right. So thank all of you for participating, but not only in this discussion, but for what it is that you do I was laughing when Dr. Meyer was talking about Dr. Miller, and I say, as many preachers as there are in Dr. Miller's family, and he decided to be a doctor, and so they preach and doctor all at the same time. And so, one thing that I'm reminded of, we talked about the churches, is the pastor of the church that I've been a part of for a long time. Generally, when he got through preaching and opened the doors of the church, he says, I have discharged of my duty. And if Israel never repents, Jacob won't lose his reward. And so basically what he's saying, if don't nobody join, it ain't his fault. Because he done did what he not only was licensed to do, but he had also done what he could do. And he hoped that people just bought in. So I'm hoping that people will buy in, because all of you have done what you are licensed and called upon to do. So thank you again. Nikki, thanks for a good evening. And I'm going to take all this information to the District of Columbia, and I'm not going to even take my vest, the one that you have to wear when you got people around who may be carrying weapons and all those kind of things. I mean, it's gotten so bad until we have to go through metal detectors when we go in to vote. And I don't think anyone would have ever thought that the United States House of Representatives and House of the Senate would have gotten to that point. But that is the nature of our being and the nature of the world in which we live. So we just have to stay the course and know that we're going to be all right. And thank you so much. Next Monday, hope to see you again.
As we always say, meet us right here, time, same bad channel, Monday nights at 7 p.m. And as always, we'd like to remind you to make sure that you take these two little brown things here and wash your hands. Make sure you wash your hands really good, get all in here, and don't forget to get in here and around that thumb, right? Dr. Maya, as you remind me, get around that thumb.
Hit that thumb, baby.
Really good.
Yeah.
Wash those hands really good. The other one, and wash those hands.
Mhm.
Also, make sure, as Yolanda Williams always says, to mask up. So make sure that you put your mask on and it goes over your nose and mouth, making sure making sure there you go. Make sure that you put your mask over your nose and mouth, not just over your mouth or over your nose or on your chin. Wear it across your nose and mouth. The droplets are what's important. You got to keep those droplets out. And then make sure that you social distance. Stretch those arms out, and if somebody is touching you or you're touching somebody else, just ask them to move over just a little bit. This will all be over soon. Thank you guys. Night. Thank you and have a good evening.
See you all. So long.